Good day, ladies and gentlemen. Thank you so much for joining us on another edition of the program You're in Your Health and on Equinoxe Radio Multimedia. Today, we'll be talking about cervical cancer. It is a disease that affects thousands of women worldwide. On today's edition of the program, we will uncover the truth about this disease. Let's first welcome my co-host, Eselu Silengo. It's a pleasure having you on the program.
Always a pleasure, Immaculate Fogri, and good afternoon to all our listeners and viewers out there.
Now, to introduce our guest for the day, her name is KOBENGE MBI Fidelia. She is a gynecologist at the Douala General Hospital. It's a pleasure having you on the program today.
Thank you very much, Madam Immaculate, and thank you, Madam Lucy. It's an honor being here.
We are talking about cervical cancer, and as a gynecologist who has been working with a lot of women maybe suffering with this disease, can you tell us what is this disease all about and how does it develop in a woman?
So cervical cancer is a malignant tumor of the cervix. What is the cervix? The cervix is the door of the uterus or the door of the womb, the point of entry. Is that part that when women are in labor, you examine and tell the woman, oh, you are 2 centimeters dilated, you are 4 centimeters dilated, you are 10, it's time to push. So what we say in pidgin, door for house for Pekin, that's the cervix.
Okay.
And when you have a malignant tumor, anything malignant means it has a tendency to spread outside of that area, to go to other organs and endanger the body. So it's actually the most serious disease of that organ, that's a cancer in that place. That's what we call cervical cancer.
What are the symptoms to watch out for?
So basically, it's bleeding outside of menstruation, irregular bleeding, usually after sexual contact. After sex, you see bleeding. Many women postmenopausal who they're not supposed to see blood, they see bleeding. You can also have women complaining of watery, brownish, offensive, bad odor discharge. In advanced case diseases, people complain of, oh, I see urination coming out of my vagina. Water is smelling like urine. That's when there's already fistulas. You have stool coming out of the vagina. You have pelvic pain. That's usually advanced disease. But the very first sign to watch out for is irregular or abnormal bleeding, especially after sexual contact.
Before we continue, we'd like to give out the numbers for those who like to participate in today's edition. We have 67054 7049, 67054 7049, or 656 6222 22, 656 6222. And back to you, doctor. What are some of the risk factors of maybe someone who is prone to suffer from this condition?
Thank you very much. When we say risk factors in medicine, we're talking of what makes it easy for you to develop cancer of the cervix. We need to know that the very first thing is having human papillomavirus infection, because what causes cancer of the cervix is infection from cancer-causing human papillomavirus, and that virus is sexually transmitted. When you have that infection, then you know that you are at high risk of developing cancer of the cervix. There is early exposure to sexual contact. We believe sexual contact before the age of 16, the cervix is immature. So the cells of the cervix are more prone to attract the virus or to have the virus change them towards cancer cells. We have multiple partners. So the higher the number of sexual partners you have, then the higher the exposure to human papillomavirus, the higher the risk of having several types of human papillomavirus at the same time. We have diseases that weaken the immune system, so they make it easy for you to get the human papillomavirus infection, like HIV, like systemic lupus, like other autoimmune diseases. We even have cases of poorly controlled diabetes. We have those types of diseases, hepatitis B, poorly controlled, reduces your immune system and makes the human papillomavirus infection more aggressive and more susceptible to changing the cells towards a cancer. Smoking increases your risk for cervical cancer. Use of oral contraceptives more than 5 years continuously will increase your risk for cervical cancer. And the most key thing I want to say today, not doing your regular cancer screening, especially if you have been or you are sexually active, increases your risk for having cervical cancer.
What are the screening tests available?
So the screening tests available in Cameroon, we have the most affordable screening test is the visual inspection with acetic acid and Lugol's iodine. Usually it's 5,000 francs and you can get it done. They apply acetic acid and Lugol's iodine on the cervix, and when it's applied, they see any changes become evident, and then they can collect a sample on that area. We also have pap smears, what you call in French frottis cervical. We also have biopsies of the cervix. Those are the screening methods. And the frequency for the screening that we really encourage is to start from the age of 25 years, and we do it once every year for 3 years, and then it becomes every 3 years up to the age of 65. Now, you remember I talked about diseases that weaken the immune system. If you are one of those people who have those diseases, you will have to do your screening once a year up to the age of 70, and not every 3 years.
Wow. Okay. And now, how can one reduce the risk of suffering with cervical cancer?
There is primary prevention and secondary prevention. Primary prevention, the very first thing is taking your human papillomavirus vaccine. We try to give the vaccine before the onset of sexual intercourse, so we give it to virgins. In many developed countries, they apply it to boys and girls, but we are aligning to WHO standards, and we have not yet been given the authorization to administer to our boy children. So our girl children, the earliest age is from the age of 9. So basically that vaccination targets age 9 to 15, the age where we say, okay, they are at the puberty stage, they haven't started sexual intercourse yet, and they can get the vaccine. Usually 1 dose, then 6 months later, a second dose of the vaccine. You have the bivalent vaccine, which targets the 2 main types of HPV that cause cancer, 16 and 18. And then you have the quadrivalent vaccine, which targets 16 and 18, as well as 6 and 11, which can cause condylomas and other vaginal warts. So that's vaccination is the first line of prevention. The second line is practicing safe sex. Wait for your body to be mature before you start getting sexually active. Don't be sexually active at a time when the cervical cells are immature and you are more prone to attracting HPV infection and consequently developing cancer. From infection to development of cancer, it can take 15 to 20 years. So you can never really know if you've had the infection or if your cervix is changing. So preventing the infection already is very important. In safe sex, apart from the age where you commence, is being in steady relationships, avoiding multiple partners, avoiding frequent changes of partners. Thirdly, the use of condoms. It is the condom, whether female or male, remains the only method that not only prevents pregnancy, but also prevents sexually transmitted illnesses. I forgot to mention that having other sexually transmitted illnesses increases your risk for cervical cancer, because most of these sexually transmitted illnesses coexist. So HIV can coexist with HPV. HIV can coexist with hepatitis B. Chlamydia trachomatis infection can coexist with gonorrhea and HPV and syphilis. So, and those infections, when they are there, they are fragilizing, they are making your cervical cells weak and more exposed to HPV infection. So primary infection, as we said, we've stated them. Secondary infection is for those who are already sexually active. And secondary prevention for those who are already sexually active, the prevention methods is basically doing your screening regularly.
So we're being told that we are almost at the end of our time. We want to know, is it curable? And also after that, we want to know what is the Douala General Hospital doing to help women with such a condition at the moment?
Now, screening for precancerous lesions of the cervix, the aim is to prevent cancer from happening. So you can treat the lesions before they become cancer. That's wonderful news. Now, when you have cancer, there's 4 stages of it. The early stages too are very, very curable. That is why we still encourage the screening. So even if you don't have symptoms, but at an early stage, we can catch it. Now, in the Douala General Hospital, we practice all those methods of screening for cancer. We also provide vaccination for the young ladies who are not yet sexually active. Where there is, after the screening, if you are diagnosed with cervical cancer, we provide confirmation tests as well as treatment, cone biopsies. We do 5 times hysterectomies for the early stages, And it's very important. We do that very well. We have even a cancer setting with several specialists where we decide together on how to manage each patient. Advanced disease remains very tricky. We depend on mostly chemotherapy and radiotherapy for advanced cervical cancer.
Tell us about the sensitization campaign.
The sensitization campaign is to encourage, to make women aware and encourage them to take charge of their health. Where cervical cancer is concerned. The month of June is the month of cervical cancer awareness. Maybe you've gone online, you've heard of Green June, Juin Vert. And so from the 26th to the 28th of June, we have an open door campaign free for all women who, and even the men who are interested in learning about cervical cancer. So they can come to Douala General Hospital. There will be several talks, and then there will be screening for cervical cancer.
Lucy, any last word?
Oh, no last word. She has mentioned everything because we are worried. We want to know if at all the disease can be treated. Yeah. So any last word on that, if the disease can be treated actually?
Yes, as I said.
Yeah, and for how long can the treatment period last?
Now, let's talk about the advantage of treating the disease.
Okay.
Early stage cancer, 90% survival rate.
Wow.
Okay.
So screening matters a lot.
A lot.
When you have cancer that has spread only to the nearby lymph nodes, you have a 60%. But once it's gone to distant organs like the brain, the lungs, the bones, you have a 20% chance.
Okay.
So when you accumulate our treatment methods, surgery, chemotherapy, radiotherapy, it can really help a patient have a longer survival rate. But it's not always cost effective.
Okay.
So let us not wait to be surprised to find ourselves in advanced stage disease. Let us do our screening, because the treatment of the precancerous lesions are very effective. You can have your children after treating the precancerous lesions.
Thank you so
much. Your family.
Thank you so much, Dr. KOBENGE MBI Fidelia. The program is really good, but then our technician is already informing us that time is up. Lucy, thank you so much for your time too.
Always a pleasure.
That was Dr. KOBENGE MBI Fidelia. Thank you so much, and equally thanks to a big number to our guests, and also to our millions of followers over there on Facebook and also on television and radio. That's all put together for you on this edition of the program. You're in your health. Have a lovely day in the company of more interesting programs on Equinoxe Radio, of course, television too.